Look, when we came into office in January 20th, only 40% of Americans said they would take a vaccine if offered to them, and most couldn't get it. So the progress from 40% to 70% is evidence of, I think, the good work that the administration has done. But we've now run into kind of a challenge that really is unfortunate. And that map you put up that showed the places where we have not had high vaccination levels, if you put that map up again, you would also see that those are all, if you put up a map of all the places where hospitalizations are now increasing in the country because of the Delta variant, it would be only in those states that have low vaccination levels. So even if we take the politics away from this and say, look, the president wants to be the president of all Americans, no matter what state they live in. He cares about people's health. He cares about their outcomes. That's the way we should be having this conversation. And if we have the conversation that way, I think we would say, get rid of all of this garbage coming out of CPAC, get rid of all this garbage coming out of Congresswoman Green's mouth. If she doesn't want to be vaccinated, that's her business. But she's this notion that anything the government's involved in is therefore tyranny.
Yes.
It's going to really hurt people that are in the eye of this Delta storm.
As you say, just saying, I don't want to take a vaccine, you know, it's idiotic, but it's your personal choice. But it's the lying to people, millions of people every night on primetime cable on Fox. I mean, would you go as far as to say that Tucker Carlson, Fox, right-wing media in general, it kind of has blood on its hands? People are dying in those states, as you pointed out, because they're not taking the vaccines. And they're not taking the vaccines because they're being told not to.
Tucker's a bad guy, period. He's a bad guy.
So
No
just to go back to my earlier question, did you ever have discussions in the White House about taking on right-wing misinformation campaigns in general?
Well, when I was in the White House, the principal culprits were the social media channels who just didn't police all of this conspiracy theorists and misinformation. And at that time, it wasn't just the right. Most of it was coming from the right. But we also have Robert Kennedy. I'm not sure whether he's the right or the left or the bottom or the top or wherever he is. But, you know, it was just misinformation in general. And it wasn't political. It was just basically people who put out misinformation, disinformation, and falsehood. But it's taken an ugly turn in the last week. In the last week, for some reason, an element of the conservative wing, the right wing, has decided that they want this to be their platform. The reason is because their base, about 3/4 of their base, finds this kind of rhetoric appealing and muscular and anti-government, and they attach it to things like religious freedom and guns. So they're just being populist.
So on that note, let's talk about CPAC that was just held in Dallas this weekend, the Conservative Political Action Conference. Conservative author Alex Berenson, a master purveyor of misinformation, had this to say about vaccines. Have a listen.
Clearly, they were hoping, the government was hoping, that they could sort of sucker 90% of the population into getting vaccinated, and it isn't happening, right? Younger people are well aware of what the risks really are.
Yesterday, Dr. Anthony Fauci called it horrific to hear people cheering for anti-vaccination remarks. I don't see how you vaccinate the Alex Berensons of this world. Is there a point where you have to say, as a government, as administration, as public health officials, we've reached the most we can reach, even if that means a significant portion of the population stubbornly remains unvaccinated?
Well, here's what the data says. The data says that of the 30% of adults that aren't vaccinated yet, approximately, about 2/3 of them are pretty concrete in their views, but about 1/3 of them, or about 10% of the adult population, still very much wants to learn more and make a decision. And we should be absolutely focused on that 10%. I think as for people like Alex Berenson, I know nobody more worthy of being ignored than Alex Berenson. These people find a niche, and they run into that niche with some kind of messaging. They don't really care whether or not it's good for people or bad for people. So I think we're better off, ignoring him.
The problem is you could ignore someone like him maybe 10, 20 years ago, but as you pointed out earlier, there's social media and there's Fox News, which amplifies someone like him, and he has a big audience and is doing a lot of damage. Andy, part of me thinks, If Trump had won the election and called the COVID vaccine the Trump vaccine, maybe we'd have more people vaccinated today, certainly in red states. On the other hand, he probably would have botched the rollout. So I don't know what the overall numbers would be.
Right. No, I think we would have seen the same thing we saw on testing and everything else, which is he wouldn't have taken accountability for it. And look, I think, let's be clear. These aren't original ideas. These are people like Trump and Berenson putting their finger into the wind and saying, oh, we've got this very strong anti-establishment sentiment. And so I think he would have found it very difficult to, even if he'd won, being a champion of the vaccine, because what he does, as you know, is he plays to the crowd. And if he hears the crowd, whether it's on Twitter or in the audience, say, we think we're anti-science or we're anti-expert, then he will do what he did when he was president, which is not really give full credence to it and try to take credit for it at the same time. So I don't think he would have been a responsible leader, is my view.
Yes.
Fortunately, we won't find out.
So we have the rise of the Delta variant. We've talked about the low vaccination rates. We know there's a clear correlation. The states with low vaccinations, they're getting hit hardest, highest hospitalization rates. The WHO is now recommending that people again wear masks indoors, even if fully vaccinated, because of the spread of the Delta variant. The CDC isn't changing its masking guidance, saying vaccinated people no longer need to wear masks indoors. Should the CDC change its guidance? And at what point are we back to a year ago where people didn't know who or what to believe because scientists, major health organizations were not on the same page?
Yes. You're making a really important point, which is we seem to be more comfortable fighting one another when we actually have something real to fight, which is this Delta variant, which is essentially last year's COVID on steroids. It's twice as contagious. Now, all the data says that if you've been vaccinated, you are very safe from Delta, and the science would say you don't need a mask if you're indoors. Now, that changes under certain circumstances, and it also changes based on our own comfort levels. And if more and more unvaccinated people have COVID and they're around us, on the margin, it makes it more dangerous for us. So even if you're vaccinated,
yes,
if you've got lots of unvaccinated people around you, that will cause a change. That's why the WHO, just speaking to people around the world, where most people are unvaccinated, is saying, hey, better precaution to wear a mask indoors. And I think we're saying, it is indeed something you could do. It's optional. It's your choice. But in many parts of the country, it's still not required.
Good point. We're almost out of time, but I do want to ask this. You've compared original COVID, the original COVID strain, to someone running an 8-minute mile, and the first variant that we got worried about, the Alpha variant, runs a 7-minute mile. Delta is running a 4-minute mile. You say the time it takes to produce and distribute 8 billion more vaccines, or even several billion more, is too long. With that in mind, did the Biden administration wait too long to share surplus vaccines with other desperate, hard-hit nations like India? It was nearly 2 months between the White House announcement in April and the first shipment in late June. Tens of thousands of people died in that period.
It won't surprise you to hear me say that when the Biden administration came in and there was zero surplus of vaccines, after we'd been promised that there was all this production going on around the world, that was the disappointment. Ideally, we should have produced billions of, if you want to look backwards, we should have produced billions of vaccines in 2020 in anticipation of this need. We have 18 billion people around the globe, and we did not have enough production. So the Biden administration has been trying to basically take, fit 20 pounds of fruit in a 15-pound bag and take the amount of vaccines that are available and ramp them up significantly. We need to produce massive amounts of more vaccines in the billions. And that has to be something that's done through the G7, but also with China, also with Russia. And we got to put all of these differences aside and work together.
I hope we can. Time is not on our side. Andy Slavitt, thank you so much for your insights, your analysis tonight. Appreciate it. Hi, I'm Mehdi Hasan. Thanks for checking out our channel on YouTube. You can see more of the Mehdi Hasan Show by clicking on any of the videos on this screen, and make sure you subscribe below to stay up to date on the day's biggest stories. Thank you for watching.